Your doctor cares more about your disease than your actual health. And many of us have experienced this, but allow for me to explain this in more detail. For centuries, the medical industry has placed a strong emphasis on studying disease, its causes, its symptoms, and its treatments. And this has allowed the study of health itself to take a back seat. And we can clearly see that this was a mistake when we take a look at the health of Americans. The focus on pathology has shaped the way doctors are trained, and this has a direct impact on how healthcare is delivered today. But the big question is, why has disease been prioritized over health? In this video, we're going to explore the reasons behind this imbalance and shed some light on what we can do to shift our focus. The focus of pathology dates back to the 16th and 17th century when disease began to take center stage. But in the 19th century, when the microscope was invented, this is when pathology took its center stage when it comes down to medical training. With the invention of the microscope, doctors began to see disease on a cellular level, and this led to some groundbreaking discoveries on how disease manifests. Now, technology accelerated the study of pathology, shifting the focus of medicine to diagnosis and the treatment of disease. As a result, doctors just started focusing on what goes wrong in the body instead of focusing on what keeps us healthy. Doctors became more equipped to manage symptoms instead of guiding patients into maintaining long-term health. But there's actually a bigger part to this overall story. The medical industry as it stands is a for-profit industry that prioritizes drugs and treatments over health promotion. After all, treating illnesses is way more profitable than preventing them. And this has led to a system that keeps patients dependent on medication instead of empowering them to maintain their overall health. Doctors only spend a fraction of their time with their patients, and during this time, they only discuss symptoms and prescribing medications. A doctor's appointment can last roughly 15 to 20 minutes, and that's not enough time to discuss dietary adjustments, exercising, and other lifestyle changes that can reverse conditions like high blood pressure and type 2 diabetes. And in America, over 50% of adults have high blood pressure and another 11% have type 2 diabetes, and we just write this off as a lifelong chronic illness. Billions of dollars are spent on medications for high blood pressure and type 2 diabetes, but in my opinion, I think that a lot of those funds should be diverted to help when it comes down to understanding lifestyle changes and preventative measures. Our doctors and the general public needs a better education when it comes down to maintaining health, and we got to shift our focus from treating disease. When doctors shift their focus to lifestyle medicine, everyone wins: the patient, the doctor, and the economy. When we focus on health and the root causes of disease, we can achieve a better outcome. But for this shift to actually happen, we got to begin with reimagining medical education. It starts by prioritizing prevention and teaching patients what it really means to maintain health. I encourage you to think critically when it comes down to your own health, and don't rely solely on the healthcare industry to manage your disease.